I would say for the parents dealing with this behavior, they're questioning what might be wrong with their children, and if this describes your child, don't give up hope, because there's definitely hope when you are at a moment where you feel completely hopeless, and you think that this is going to be your fate and your child's fate and all the hopes and dreams you have for your child. Just don't give up, because I'm seeing proof right here with Dr. Herman. He has been a huge blessing to my entire family, and especially to my daughter. And she has made a huge improvement, and our quality of life has improved dramatically. So just don't give up, and call Dr. Herman.
Thank you. Hey, hi, I'm Dr. Lonnie Herman, and I'm here with a mother of 3 children, patients of mine. This is Leigh, and I appreciate you getting on this video with me today.
You're welcome.
Yeah, thank you. They come from another state here in the United States. My clinic at this time is right here down in Southeast Florida, and we've got an exciting progress to share with you all about her youngest of the 3 children that we're treating for various symptoms. And I guess I'll just let you tell them about it. So what was life for your youngest daughter? What was life like for you and her and your family? And what were if you can tell us about the certain issues with personality or with stress in the environment, what you can tell us about that before we get to how good it is now.
Certainly. So she was a bubbly, happy child, and I did long-term breastfeeding. I stopped at 3.5 years of age. The moment I stopped, within that week, it was like the floodgates opened and tons of sensory issues started hitting her, and I recognized it right away because she has a sibling with autism, and clothing would bother her, where she would wear hair bows and was excited about shoes and outfits. All of that bothered her. She would pull them out. She would start screaming. Baths would start to bother her. Water on her skin. Routines were a thing of the past, where we were very routined. It was anything goes. She would have screaming fits for several hours. I think one time I counted almost 5 hours on a tantrum. It was pretty severe. And when I say tantrum, it was at times blood-curdling screams, periodically throughout that 5 hours. And to get her to stop was nearly impossible. I would have to use a method to try to redirect all the skills that I learned in therapies with her sibling. I would use that, and it was very difficult. When it would work, it would take about an hour to get her to calm down, or bribing, or just whatever I could do. She would want to wear one outfit at home, and that one outfit would need to carry over to go somewhere in her mind, and which was impossible.
What do you mean by carry over? Is that she wanted to wear it the next day? What do you mean?
She wanted that outfit to be worn out in public, everywhere, to sleep, and that was just not reasonable. So because they were bedclothes and to sleep in, and so I would have to start a day or two before to get her used to the idea that we were going somewhere, that she had a lot of social anxiety. And that was never the case for 3.5 years of her life, her first 3.5 years. And she would be very stressed out, thinking about being around a crowd of people, the noise, in a public place, and also the outfit. I would start introducing various items. We would go through, she had plenty of clothes, really beautiful clothes, and we would go through probably at least 20 items every time we would get ready to leave the house. And I would start 2 or 3 days before, knowing we were going somewhere, hoping that when we reached that day that we've already got it handled and there would be no tantrum. But it just didn't work.
It didn't work. So you were prepping her for days, saying, all right, Wednesday,
Yes.
it's Monday. Wednesday, we've got to go to wherever it was.
Yes.
We're going to go to a family gathering, or we're going to go to a doctor, or and you had to prep her and say that let's start picking out your outfit now.
Yes.
Because you wanted her to be satisfied and be able to get to the point on Wednesday, hypothetically, that that's the outfit she's going to wear.
Oh, yes.
And so she could go through 20 outfits, almost no success. Wednesday would come, hopefully you got one, and then Wednesday would come and it was another problem.
Yes.
And then to get her, and then so that was another challenge. So that would take you hours on that, hypothetically Wednesday.
Oh, yes.
To just get her to agree with, this is the outfit that I'll wear.
Right.
Right? And it was constantly changing and changing and changing. 'Cause
Yes.
What was she doing? Was she screaming? Was she just like, I'm not satisfied, and running in another room, throwing a temper tantrum? Was it just, I'm not going out with that?
Well, it was a little of all of
of
that. Yes. She, if I were lucky, she would try one or two outfits on, but usually she would just look at it and get very stressed out, start crying and screaming, and I'd say, calm down, we're not putting it on, it's okay, let's try something else. So it was, and what worked one day may not work the next
You
trip.
mean of your bribing way, of your trying to calm her way? Is that what you mean?
On a particular outfit I might use to go out somewhere, that might be the outfit I would go to the next time, but that didn't always work.
Yeah.
Because then she would think of one thing like elastic or something just sensory related that she said would hurt her or bother her.
Okay. So the clothing could hurt her, the hair clips or hair ties could hurt her.
Oh, yes.
The water in the shower or bath would hurt her.
Yes.
She threw temper tantrums, anxiety in public. She didn't want to, I remember when I first met her, she didn't want she was peeking her eyes around the corner. She was hiding from me and didn't even want to come in the room. Didn't even want to really sit here and discuss. She was just too shy and too anxious. Her hours, I think I remember when we first spoke, as you just gave a little insight a minute ago in your discussion, but it could be like hours and hours and hours with the temper tantrum, number one, screaming, but it was also that it could take you how many hours just to get her ready to be able to say, we're going out to get in the car to go somewhere. How long did that take you on many, if not all days, before coming in here?
Before coming here
before our first visit together.
So it would, on a good day, an hour.
And on a bad day?
A bad day, all day.
All day, like literally.
All day. I would start early in the morning.
What was early in the morning?
Let's say around 8 o'clock.
8 o'clock. And by the time you were able to, all day being like by 1 o'clock in the afternoon, are you talking like 5 in the evening?
We're talking about 4 or 5 in the evening.
To be able to finally.
When the point was moot to even leave.
It was moot to
Yes,
even leave. She was just like the whole day is gone.
It controlled everything.
It controlled everything. You weren't able to get out of the house.
It was difficult.
Basically. And even sleeping at night was a problem for her too, right? She's just like.
Yes, there was no off switch in the brain.
No off switch.
And she ended up, so I knew all of this was off because of what I dealt with her brother with autism. So we went to get a diagnosis.
And what did they diagnose her as?
PANS and PANDAS.
And what did you do prior to coming here? What did you do for her? Was it like gluten-free diet, dairy-free diet? Did you try supplements? Did you try antibiotics?
We tried, but she was very resistant. And they put her on a round of antibiotics, and it actually, and they said, we don't know which way this will go. Let us know. We have to try different things. So they tried a round of antibiotics. I believe it was for 2 weeks, 1 to 2 weeks. I can't remember. It's been a couple of years.
What was the result?
She became worse.
Worse, yeah.
She was in a rage.
Yeah. I'll talk more about that later, what I think made that happen in another video that we'll get to in a moment here. Because I can describe, with your permission, I can describe some of the exam findings?
Yes,
yeah, okay.
Please.
So, what we're treating her with. So it was all-consuming, very stressful. You were just like, your life is like, you love your children.
Yes.
You're all for them, but it's a destroyer of any like good, enjoyable time, right? Very challenged just to be able to get up and get out of the house. You couldn't even get out of the house,
right?
Barely. So at this point, and we're after like the second or third treatment, I don't remember, that I'll discuss in the next video, but after you started noticing some changes, positive changes for her, right, with this work?
Yes.
Yeah. What is it like now with her getting dressed?
She got up today, this is an example, and she picked out her own outfit. She put the clothes on without an issue. She took a shower on her own, and she's scared of showers. So that's huge.
Takes a shower on her own, scared of showers before, no longer scared of a shower.
Right.
Picked out the outfit, got herself dressed. No 20 outfits.
No.
Not all day.
And I expected it, but it didn't happen.
But you were expected because you were so like programmed for so long that was the
Right.
case. But you've had there's just more than just today that she was able to pick out her own outfit and get
Yes.
ready and take a shower without a challenge.
And no tantrums
And no
all day
tantrums.
long. This
And,
is stopped in
she's-
May with the tantrums
Stopped in
around May.
Right now we're September of 23.
Yes.
So by May and all the hour-long tantrums stopped. They've not returned.
Periodically, she will get upset, but I notice she's able to self-regulate a
So
little
with
bit.
the tantrums were daily or like multiple times a week, every day?
Multiple times a day.
Multiple times.
Worse than what I ever dealt with my son having autism.
Multiple times a week, and now how often is a tantrum?
She might be a little oppositional every day, a little, but it is quickly stops. Quickly. We're not in the floor trying to get her up while she's having a tantrum. It's nothing like
She's
that.
very pleasant today coming
Yes.
in. Yes, there's no social anxiety.
That's
at
how
all.
she's been.
Zero. It's a dramatic improvement. It's nice to see her that
Her
way.
real personality for the first time
very
since she
sweet.
was 3.5. Her true self is shining through.
very
And she's
sweet.
a very
It's
sweet little
She's
girl
sweet.
and
I remember
outgoing.
when I first met her, she was like very kind of, what's the word? She was very almost like sarcastic with me.
Yes.
There was a certain thing about her. I don't know if sarcasm is the right description, but it was definitely not the most pleasant, I'll just
Yes.
say. And so most often in her days now when you're getting ready to go somewhere with your family, she can get herself dressed, or you might help her pick her
She
out.
gets
like
herself
one-
dressed.
She gets herself dressed.
Yes.
And that was impossible. How many years was it prior to coming here that it was like 20 outfits that you had to try to pick out and get her ready? How long was that going on for before you came here?
Oh, from 3.5 on.
I forgot her age right now.
She
sorry.
just turned 8.
So 8. So you're talking like at least like 4 years.
Yes.
At least 4 years of
Yes, my whole life had to be
consumed with this.
it had to be molded around the behavior. Anything that would make life easier, grocery pickups, anything, just because of the behavior.
So the behavior is totally like, it's almost 100% better.
Oh, yes.
Like night and day,
Yes.
basically. There's a little bit more that we'll deal with, but basically.
I'm able to enjoy her and sit
Enjoy
and
her.
talk with her and do activities with her.
No more torture.
No,
It was torture. It was tough.
pure torture.
That's a pretty good word to describe it.
Yes,
Torture it was.
it's accurate.
Yeah. And so other people you had gone to, they diagnosed her with PANS or PANDAS, and their
Both.
treatments didn't work, and both, and we're seeing it. So I appreciate you getting on this video with me. Is there
You're
anything that you want to tell anybody who's out there who maybe thinks it's too good to be true, or since they didn't see your daughter before and after, this
Yes.
is obviously, this is a real experience.
Oh, very
and it's
real.
very real, and it's real results.
Mm-hmm.
Is there anything that you want to tell anybody, maybe who thinks it's too good to be true, or things like how could it work, or whatever, or that like they're still stuck in a certain pattern that it just can't work, or they need a certain medicine, or they need to follow a certain diet, or whatever? Is there anything else that you want to tell them? You've given enough, so if you're...
Yes,
you think I don't know-
no, that's okay. So a trigger for my daughter is dairy, and I can clearly follow the pattern, which is something that the doctor that diagnosed her also said to stay away from. So if she got a hold of it for some reason, I could clearly see that it would stir up behavior. So that was a trigger. Gluten can be as well. But I would say overall,
And so, I'm sorry to interrupt, but those triggers that we can fix with this work.
yes.
So there's still, I'm going to go back and check that today, but we can fix that. So even with that, but even prior to coming here, you were at gluten-free and dairy-free, and she still was a problem.
Yes.
True. There's no
Yes.
difference with that. So now it's going to be. So what were you going to say?
I would say for the parents dealing with this behavior, they're questioning what might be wrong with their children, and if this describes your child, don't give up hope, because there's definitely hope when you are at a moment where you feel completely hopeless, and you think that this is going to be your fate and your child's fate and all the hopes and dreams you have for your child. Just don't give up, because I'm seeing proof right here with Dr. Herman. He has been a huge blessing to my entire family, and especially to my daughter. And she has made a huge improvement, and our quality of life has improved dramatically. So just don't give up, and call Dr. Herman.
Thank you. All right. Hold on for just a moment. We're going to flip to another video where I'll describe her exam findings and give you better insight of what's going on in the brain and the body. And you too, your child can, your family can overcome these different behavior disorders, and without drugs, without medications.
Yes.
And real healing can happen. And I'm here to help you. I'm here to do it for you and with you. And it's a great passion of ours. So hold on for the next video, and I'll see you in just a moment.